everyone, this is Learn, Live, Repeat, and as promised, I'm back with another video discussing the different bones of the upper limbs, especially showing you guys the labelings and the diagrams so you can get a better view at the visuals of these bones. And for this video, the main bones that we're going to talk about are the ones that we already discussed in the previous video. And the first one would be this big bone of the upper arm that we see right here. It is the humerus. And we're just going to move to the left humerus over here that has all the markings. So here we see at the top of the bone, we see the humeral head or the head of the humerus. And as mentioned, we have two tubercles in the humerus, the lesser and the greater tubercle. The lesser tubercle is on the medial end and the greater tubercle lies a little on the lateral end. And as you go down the humerus, this area right here is known as the shaft of the humerus. And the shaft on the lateral side has another tuberosity that is known as the deltoid tuberosity, where the deltoid muscle attaches. All right, moving on to the distal humerus. This is the key point where a lot of things are happening at once, also because it is important in the formation of the elbow joint. So we're just going to see it one step at a time. In the medial and the lateral side, so medial and the lateral side, you have the epicondyles. You got the medial epicondyle and the lateral epicondyle. Then right below the epicondyles, you're going to see this little bony structures, and there are two of them. The one on the medial side is the trochlea, and the one on the lateral side is the capitulum. Now what these do is help serve as attachment points for the head of the radius as well as the ulna. And that is important for the formation of the elbow joint as a whole. Now again, we also discussed that the humerus also has three different fossas. On the lateral side, you have a radial fossa where the head of the radius kind of slides in. On the medial end a little bit, you have the coronoid fossa where the coronoid process of the ulna slides in. And on the posterior, or on the back side of the humerus, which is not visible in this diagram right here, but you have an olecranon fossa where the olecranon process of the ulna slides in. So yeah, this is the humerus and the main parts and the main processes and the fossas of the humerus that are important to keep in mind. All right, moving on. This is showing us the attachment of the radius and the ulna, and we have the right and the left part. I think we have the right anterior as well as the posterior. Sorry, it's not the right and left, it's the right. So this one's the anterior and this one's the posterior. Okay, and the way I can tell that is because we have the olecranon process right here, and the olecranon process is present on the posterior end of the ulna. But anyways, we'll get to that. So on the anterior side, we can see, and we're talking about the right arm. So on the lateral side, this bone right here is the radius, and this a little longer bone right here is the ulna. And here on the serving the site of attachments, you have two radio-ulnar joints, one in the proximal end, one in the distal end. So it's the distal radio-ulnar joint right here, and then you also have a proximal radio-ulnar joint right here. And what happens is on the proximal end, the radius is attaching to the ulna. So the ulna has a radial notch. So that's why it says radial notch of the ulna right here. And on the distal side, the ulna attaches to the radius. That's why you have an ulnar notch of the radius right here. All right, another thing to keep in mind is that the head of the radius is proximal, but the head of the ulna is distal. So they're just kind of anti-parallel to each other in a way. All right, between both the bones, it's not just, empty space. You have something known as interosseous membrane that is kind of filling the gap between these two bones, acting as a cushion and a very good shock absorber. Let's see what else. We also have the important processes of the radius and the ulna. So in the ulna, first of all, you have a trochlear notch that again fits into the trochlea of the humerus and is one of the important attachments of the elbow joint. Then you have the coronoid process that again kind of fits into the coronoid fossa of the humerus, again an important attachment for the elbow joint. Both of these, now the ulna and the radius, both of these have a styloid process on their distal ends. So here you can see the styloid process of the radius, and then here you can see the styloid process of the ulna. So both of them on their distal ends, they share this one styloid process. All right, so moving on to the bones of the hand and the wrist. Now here you're seeing your left hand, but in the anatomical position. So in a way you can say that this right here is your palm. All right, so it's facing upright, and then that's why on the lateral side here you can see the radius, on the medial side you can see the ulna. Your wrist bones right here, we talked about 8 carpals that are color coded in green. You have 5 metacarpals that are color coded in yellow, and then you have 14 phalanges that are color coded in blue. So once again, your carpals, they go by the mnemonic, she looks too pretty, try to catch her. And we're going to go lateral to medial. All right. So you got scaphoid, lunate. Sorry, scaphoid is this one big bone. Lunate. Triquetral is this bone, triquetral. And sitting right on top of triquetral, you have the pisiform. So you got the first row, or the proximal row, she looks too pretty. And then you have try to catch her, or the trapezium, the trapezoid, capitate, and hamate. All right, so that's your distal row. So you got the first row and the second row, the proximal and the distal row. So those are your 8 carpals. And you can see how it might not be the most clear over here, but the distal end of the radius attaches with your scaphoid and lunate for the most part to make up your wrist joint. All right. The phalanges also, you can see that for all the 4 fingers, they're divided into 3, the proximal phalanx, middle phalanx, and the distal phalanx. Same for all of them. But here in the thumb, we only have the proximal phalanx and the distal phalanx. So that is also one thing to keep in mind, that you do not have a middle phalanx in the thumb. Other than that, we ended talking about the different joints. So we talked about the joints over right here. They are the carpo-metacarpal joints because they're connecting your carpals with the metacarpals. Then right here on your knuckles, you got the metacarpophalangeal joints that are connecting your metacarpals with the phalanges. So all of these right here, you can give them a short name as MCP, or metacarpophalangeal joints. These first joints in the fingers that are connecting your proximal phalanx to the middle phalanx are your proximal interphalangeal joints, or the PIP. And the other ones are your distal interphalangeal joints, that are your DIP. And the distal interphalangeal joints, as the name suggests, it connects your middle and your distal phalanx. All right, and here in the thumb, you have this one joint known as the interphalangeal joint, just IP for short. All right, so that is it for this video. I hope this would help, considering we discussed the theory first, and now we're able to see the visuals a little better. And yeah, so this is the anatomy, and we're going to move on soon to more different bones, so stay tuned for more videos. Thank you so much for watching.